Hello, I'll be discussing fetal alcohol syndrome, and my name is Rebecca Frusciante, and we'll be going over the causes, symptoms, expected behaviors, and some strategies to deal with this. A couple things. If a baby looks normal, then it must be fine. Unfortunately, over 85% of these children with these disabilities have no physical deformities. And then it's cool, I'll just have a wine cooler. This shows that it doesn't matter the size of the alcohol, that it all has severe effects on a child. There is only one cause of fetal alcohol syndrome, and that is women drinking while they are pregnant, especially during the first trimester. A lot of times this happens because women are unaware of the fact that they are actually pregnant. Some of the symptoms include brain damage and growth problems, and again, these vary child to child, and there is no cure for fetal alcohol syndrome. Some of the physical symptoms that might be seen are small eyes, exceptionally thin upper lips, upturned noses, deformities of joints, limbs, or fingers, slow growth, vision difficulties, hearing problems, small head circumference and brain size, heart defects, kidney problems, and poor coordination. This is just a photo showing a little bit more of the physical deformities that might be observed in a child. The brain and central nervous system is also affected, concluding in intellectual disabilities, learning disorders, delayed development, poor memory, attention problems, poor judgment skills, and rapidly changing moods. Some of the social and behavioral outcomes then become poor social skills, trouble with transitioning, impulse control, attention problems, and poor concepts of time. A couple of things medically. There is no cure for fetal alcohol syndrome. According to an article from the Molecular Psychiatry, there have been several studies demonstrating the successful rescue of alcohol-induced phenotypes in vitro and in animal models using vitamins C and E, folic acid, glutamine, boric acid, chlorine, or selenium. Unfortunately, such treatment showed no significant effects when it was used in humans. Some other factors that go along with how severe a child may become due to fetal alcohol syndrome depends on the mother's weight and age, whether or not she was drinking throughout the entire time period or just a small portion of it, along with other combinations of whether or not she was on drugs or medications. And about 95% of people with fetal alcohol syndrome also have a mental illness. Some statistics that go along with fetal alcohol syndrome include children with fetal alcohol syndrome will cost over $2 billion over the course of their lifespan on treatments and secondary disabilities. There is no actual cure for it, and therefore it does become a lifelong disease. And up to 1 in 20 American kids fall somewhere on the spectrum of disorders caused by maternal drinking, according to this study, more conservative estimate, but that number could be as many as 1 in 10 using any other approach. Some challenges students face is hyperactivity, impulsivity, attention deficits, and memory deficits. There's also an inability to complete tasks, which may cause disruptions. They have poor social skills. They rely heavily on supervision because they do have a disregard for rules and authority. Some strategies that can help out with this is creating concrete and hands-on learning, creating routines that are very structured. Sometimes if something needs to be veered off the routine, a first and then chart might be helpful, where they can see that first they'll get this done and then they'll be able to possibly move on to the next activity or take a break. Instructions for them should be short and simple, and even possibly creating a reward system. This is Class Dojo, which was used in the school that I work at, and it's a great tool because it shows not only the positive but the negative points that the child can receive throughout the day. And this is a great way to have all of the children incorporated in it versus just the one child that may be struggling to control themselves. And then this will also help out when filing for IEPs, that it will continue to keep a report of their behavior throughout the time that you use them. And then there's our references. Thank you for listening, and I will hope to respond to a couple of your questions. Have a good day.